Three.
Good morning, everybody. We want to give you the update from our board meeting so you can kind of make sure that you're informed. We've had some great forums, so really want to thank everybody for coming, and we had some exceptional questions. So I want that to just continue to grow, and please, between now and next month, go ahead and submit any questions that you have that you want to actually be shared at the next forums, so we can make sure that, if you've got a question, you're probably not the only one. So let's make sure that we can keep really good, transparent communication across the organization. So we've got some exciting things, I think, to talk about today. One is, when we think about debt reduction, just to kind of recap, probably about 15 months ago, roughly, we had about $34 million of, old debt. Now, as of today, we're at about 4.9. That 4.9 is really going to be completely retired in the next 6 weeks. So we will have wiped out all of that old debt. So every person in this organization should be proud of that and excited about that, because it's taken this whole entire group for us to kind of continue to move forward. We're making a lot of progress and really looking at how do we become sustainable, right? So when we think about us as an organization and long-term security, the vital piece of that has to be that we need to generate enough income to pay our expenses. And really where we need to be, right, is we generate a little bit more than what we actually have to pay our expenses, so we can start to build a savings account. And a lot of that savings in the first couple of years, right, is going to be us really reinvesting in the organization. There's equipment we need to buy. There's definitely facelifts as we look at, some of our departments and areas that we need to be redoing. Our patient rooms, right, need to be modernized, where we actually have the ability to control heating and cooling individually. When we think about flooring, etc., paint, all those things need to take place, and we're going to have to be really strategic on how we're going to strive to make that happen, because it'll have to be methodical. I wanted to talk about the swing beds, and in critical access hospitals, it's one of the benefits. You have the acute care side, and then you have the ability, when you have a critical access designation and then you get a swing bed designation, you have to get certified for that you can actually use or flip some 1, 5, 10 of your beds. It doesn't matter. There's not a limit. We have a total limit of beds, which is 25. But you actually can turn those beds into a skilled nursing bed. And so everybody probably knows at this point that on the acute care side, we have an average length of stay of 4 days. And so it needs to be average, and it's average over the year. And so you'll have some people that'll go past 4, some people that'll be a little less than 4, but at the end of the year, we need to make sure that we're at 4 or less to meet the requirements that CMS has put on us. And it ties into our designation for critical access. The other way for us to be able to not impact that negatively, as far as that 4-day length of stay, is for us to look at patients that are going to need longer. They're going to need a longer stay. They need care longer, but it doesn't necessarily need to be in the acute care phase. And so what needs to happen in these swing beds for us, one, it's a new revenue stream, because we discharge the patient from acute, and then we readmit them into the swing bed status. And so that kind of, on the Medicare side, it completely changes what we're now going to have the ability to get paid for. And so in a critical access hospital, your actual revenue and what you're getting paid really sharply declines after day 4. And so what for us, if we've still got a significant level of care we need to provide to these patients, we need to be able to get them into the swing bed status and then that really kind of starts the clock all over again, one on a new length of stay as well as a new revenue stream for us. And so that is very, very positive for us. The other thing that's really exciting, if you think about, where skilled nursing from a staff ratio standpoint is, we're always going to have a much better ratio than that. And so it is a great, great, great service for us to have the ability to provide for our patients in the community. And also if we can get transfers in as well. And so as long as they've had that 3 midnight stay on the acute care side at another facility, we can take transfers in because we're one of the few places around here that have swing bed capabilities. The other thing I want to talk about is Bright Ideas. And we're going to give a lot more detail next month on that. But, as we have started this journey of continuous improvement, and we really want to continue to grow and polish and strive for excellence, right? We are constantly really wanting to push ourselves to raise the bar, both in our craft and what we do in our jobs, because what you're delivering each day to this organization, that's a craft, right? And we want it to be polished, and we want it to get better and better and better. And part of that kind of formula, if you will, is that we need to make sure everybody has the right tools, right? The right environment, the right culture. And so we're working on all those things from multiple different angles. But one of the big key drivers is as we look at individuals that work within our organization, they have very key insights. And those key insights are really how we can tweak these departments to make them run better, to make them more efficient, to make them have less redundancy. And so in order for us to do that, right, we have to have a process and a plan for us to be able to elicit and then support those ideas that now will become solutions in helping us move the organization forward. And so the Bright Idea program, we're going to actually go into a lot of detail, introduce the forms, we'll do some training, and all that is going to be kind of fully unveiled at the next forums next month. Operational KPIs, I wanted to give you, it ties into Bright Ideas, but I wanted to talk about just key performance indicators. We've rolled them out. Every department, for the most part, I think, is measuring some stuff, right? Whether it's efficiency, how you're doing beds, floor to discharge, how we're turning rooms over in the OR, quality metrics that you're measuring within your department. And so what typically happens in a lot of organizations is you've got all this great work that's taking place, but a lot of times it doesn't really get transferred up, so there's a level of transparency across the organization of the stuff that we're working on. And so that's one kind of barrier, if you will. The other barrier is that without having that transparency, there are very few things that any of us do in an organization, because we're so interconnected, that we don't have the ability to impact either upstream or downstream in one other department or in a process. And so when we start to think about how we are working in the organization, one of the positive things for us is that we need to be able to have cross-departmental communication improve. And a way to do that is really having a lot of transparency on what are we all measuring when we problem solve those things, and how we're going to actually impact it to improve it, to make sure that we're not breaking something upstream or downstream. And so we started the huddle process to be in person. It's in the library every day at 9:00. All the leaders come together, and we actually kind of go through the board that we have that has metrics across 6 pillars. People come in and put their numbers in for the previous 24 hours, and we really talk about aberrancies, right? What we want to discover is we want to discover when we've missed the mark. And that's not for us to be sad about that. That's for us to be excited about that, because we want to fix it, and we want to fix it quickly. And, as in most things, right? If you can discover, hey, I'm kind of off the path a little bit, I'm heading into the ditch. If you can course correct that quicker, it is much, much easier than if you've kind of dug a big, deep hole, right? That's been going on for months. And now you're trying to kind of dig out of that. And so really it's about that variation notification. What is going to happen? Everybody is welcome to come. But what's going to happen in the future is, in order for us to kind of roll this out into the departments, I want to do this from a very methodical, from a methodical perspective. And so we're going to pick 2 departments, one that will kind of that's under the CFO, and one that's under Curry, the CNO. And so I want to do 2 first. I'll work with those teams. We'll build their boards. We'll facilitate. I'll probably be the ones that'll actually kind of lead the huddles initially, and then I'll train the department to be able to do that. And then once we kind of get those 2 up, then we will start cascading that across the organization. The whole entire goal about that is for you to be able to manage your departments, empower you that where variance is. You also know what needs to be fixed. Now we need to give you the tools so we can start fixing those things, with you being empowered to drive that change. Ortho program development. So we're going to have, when we think about service lines, there's going to be a number of service lines that we're going to actually want to do programs. And what that means is we're looking at a certain procedure. And in this particular case, it's total joints, total knees, and fractures will also fall into that kind of bucket, if you will, of that patient population. Well, when we look at how we kind of deliver care today, it's pretty episodic, and it's pretty much siloed to a degree within those departments. And when we think about patients and how we want to drive outcomes, in order for us to drive really highly consistent outcomes that really are exceeding the marks, when we think about how we would measure ourselves nationally, the only way you really do that is to take out variation, right? If we have variation, then you're going to have people that are going to, miss this, not do this exercise, not get this particular med, not have the right ambulation, any of those things, right? All that variation will end up potentially impacting how that patient recovers. And so as we start to look at that process, we're really starting to look at that patient population and look at them before surgery is even scheduled, all the way to about 6 weeks after discharge. And so we want to kind of make sure that we've got the right support, the education, the right people connecting with them, and that everybody goes through the same process. And so it makes it significantly easier for us because, right, everybody's not the same. And we all are free-ranging humans that, don't always follow the rules. And that is life, right? But if we can make sure that we're educating everybody to a level where they can understand the why and how important this is, the percentage of patients that will follow that, and that alignment that will occur will have a big impact related to results. The other piece that is also exciting about that is we all have different comorbidities, right? And how we manage those things. And so when you have programs and you get, those patients to be in those programs, it's a lot easier for us to be able to, one, recognize and also make sure that we have the right countermeasure or the right solution, right, to help support that comorbidity so it doesn't negatively impact that patient's recovery. Last thing really is our focus on community. Our community, we have to think about, all of our peers and colleagues, all of our, whether it's the college, it's what we would maybe consider a competitor, Indian Health Services, that is, the hospital that, of course, is, a couple of blocks away. We have to work together, right? Our community is our community. All of us live here. We all need to make sure that we are really supporting the health of our community, supporting how we need to cover and support our patients and families. And so none of us have all the answers, nor do we have all the resources. And so we really need to tackle this from a more global perspective. And so we're going to do our part to make sure that we can be supportive and collaborative. And we want to continue to build relationships or enhance the ones we already have related to the community resources that we have within our community. And then how do we really kind of drive healthcare maybe in a more advanced, more progressive way as we continue to work towards the future. So that's the updates for this month. I hope you're all having a great month, and thank you for your time and attention.